and today's subject is going to be about chiropractic care and pregnancy. So I'm gonna ask them a couple questions like I did before, and you guys are gonna get educated. All right, so first question, is it suggested to get chiropractic care when you're pregnant?
Yes, very much so actually. Many people don't know, but chiropractic care can really help with pregnancy. It can really help with a lot of aspects of the process of pregnancy. It's gonna do a lot for the bones and obviously and the musculoskeletal structure, so it's gonna relax a lot of the ligaments and relax a lot of the hip joints and everything, and really just keep the body in balance. You know, we're really working with the nervous system as chiropractors. So when we're affecting that nervous system, what it's going to be doing is keeping that every other system in the body healthy while you're going through this process. So it's really important actually, and it really does. I find a lot of pregnant women that do go to see chiropractors regularly during the process, they have a much easier time.
So far as symptoms and stuff like that?
Symptoms, so far as, you know, hormonal imbalances, things like that, yeah.
Okay, so just like the regular person with pregnancy, there's just a little bit added aches and pains as the body gets bigger and the baby's developing. Most clients complain about sciatic pain and, you know, concerned about how it may affect labor. Can you speak on that?
So with sciatic pain, what usually happens is that usually originates from kind of the low back. So when a woman is pregnant, right, everything's expanding, kind of moving and changing. Now the skeleton doesn't always do that naturally, right? A lot of the soft tissue and organs and things are obviously going to do that pretty, you know, a lot easier than a structural bone, you know, is going to shift or move. And the other key to that is if a bone is already kind of weakened or out of place or kind of on top of that nerve a little bit. So some patients already kind of get, you know, occasional low back pain or occasional hip pain. And when that stomach starts to change and grow and everything shifts in the body, it's expanding everything, and sometimes it does make these issues that were already there worse, or it brings about new ones because of areas in the spine that weren't, you know, already in their natural place. So yeah, what tends to happen, especially with sciatic pain, is we, you know, women do experience that phenomenon exactly from what I just said, right? Because the issue was most likely already there in some form of another. So obviously, when we're adjusting that pregnant patient, we're going to relieve that tension and relieve that area, that pressure on the nervous system, which is going to, you know, very much affect that sciatic nerve and pain.
Okay, and then is there, like, which trimester can I start a session of chiropractic care?
You can start immediately. I mean, you can start from day one. You can start before. You can start after. I mean, even we find after, you know, pregnancy, labor and everything.
Kind of like postpartum care.
Postpartum care, it can really help, you know, because they're obviously, you know, birth is a traumatic process, right? Mm-hmm. Traumatic experience, physically, mentally, emotionally, right?
Right.
So, you know, we can really just help the entire system kind of recuperate and come back.
Well, I heard you earlier talking about hormones. Can you expound on that and how it affects the pregnant woman?
Yeah, so obviously when you start to become pregnant, you have a lot of different hormones that are coming into play here, right? You're having a lot more relaxin, which is actually, that's a hormone that's going to kind of relax the body, right? Relax the musculature, the skeleton. So it really does make the adjustment a lot easier, and we actually put on a lot less force because we don't need to use this, you know, normally we don't even use too much force anyway, but, you know, we do use a lot less force because of that hormone specifically, right? And in general, you have a lot of other hormones that are just, you know, obviously changing and growing. And what chiropractic does is, again, work with that nervous system, and what that nervous system is going to do when it's in its proper balance and proper place is what it's going to do is help your body function properly, right? So it's going to control all of those glands in all of those areas in the body that are secreting hormones is going to actually keep that system healthier, right? So it does, I mean, many pregnant women do find they just overall just feel better, you know, while receiving chiropractic care during pregnancy.
All right, so the other question has to do with symptoms like nausea and vomiting, as well as swollen feet and hands. How can chiropractic help with that?
Yeah, so nausea and vomiting, a lot of times, especially in the first trimester, you know, obviously everything is kind of expanding again and shifting. And what that's actually doing is causing more pressure onto your, obviously a lot of the systems, but it's mostly really causing that pressure on that gastrointestinal system, right? So a lot of pregnant women tend to have, you know, acid reflux, right? You start to have those issues coming up, right? And it's causing a lot of kind of vomiting, and it can cause a lot of nausea too as well. And chiropractic really does shift and, you know, help that.
And you were talking about also with Gerd too, right?
Yeah.
Is that similar? What's the difference between Gerd and acid reflux?
That is the same thing.
Same thing. Okay.
Yeah, gastrointestinal reflux disease.
Gotcha. Okay.
Yeah.
Well, good to know.
And in terms of the kind of the swollen, you know, the swollen hands and feet, that can happen a lot from kind of just vascular issues, you know. So it's really going down to, you know, the deeper level of, because when we're adjusting the patient that is pregnant, what we're going to be helping a lot of issues that wouldn't arise, that may not arise, you know, such as like gestational diabetes, preeclampsia, you know, all these things are going to have an effect kind of on these vascular issues or imbalances kind of in the system.
So would you say that the pregnancy, I think you kind of just said it, pregnancy kind of highlights that you may have underlying health issues, because if you were never pregnant, then your body wouldn't try to adapt to what's going on.
Right. I mean, there's also a form of, obviously, it's kind of exacerbating, you know, everything that's going on.
Because of all the pressures.
Because of all the pressure and changing.
And then would you consider, like most of the time they say to get, even before you decide to get pregnant, to get prenatal, in its true form of prenatal care. That's something that you should think about if you're going to want to get pregnant, is, you know, doing those other things like massage, chiropractic, and stuff like that, just to get your body in the best physical fitness it can, right?
Right. Same with exercising, you know.
So are there any contraindications?
Not many. I would say that there are a few, definitely. I mean, in terms of, you know, we're working with the skeleton again, right? The structure of the spine. So if you do have any fractures, kind of any instabilities in the spine, or any kind of cancer or anything like that, we wouldn't want to, you know, work with that. But other than that, yeah.
So we have changed scenes to give you guys more of a up and personal experience. So most women, they are concerned about the process of getting a chiropractic adjustment. So we came in this room so he can just give you a little show and tell.
Yeah. So, I mean, that's a real concern, right? Obviously, you know, you want to keep the baby safe. You want everything, you know, to feel safe. You want to feel comfortable when you're actually receiving that adjustment. So I'll just kind of tell you about the process of how we actually do adjust a pregnant woman, right? So during pregnancy, what we can actually do is we have a few different tables we can use, but I'm just going to show you a couple today. But during usually the first trimester, pretty significantly into the second trimester as well, when the stomach isn't as large, right? What we can do is we can actually shift the amount of pressure on this table here. So when the patient actually, how you do come into this table is the patient actually comes face down, right? And this table kind of drops. I'll kind of show you that. The table kind of drops here. And when this drops, we have the patient lay face down, and we can actually shift the amount of weight that this kind of belly portion will actually have on the table, right? So we can make it heavier, we can make it We can make it lighter, or we can make it easier for the belly to kind of move in, right? Now, when the belly does start to develop a little bit more, this is when we get into the second table here. I'll have you come over here.
Oh, I'm gonna be demonstrating.
So yeah, is there?
So bigger belly.
Huh?
This is for the bigger belly.
Yeah, yeah. So you just put just your face there, right? And the hands kind of on the sides there. Okay. So this is good here, right? So what we have here is this is the position we would have the patient in, right? When they're farther along, right? There's no pressure on the stomach here. We would actually be just adjusting the spine here, right? And again, like I said, it's going to be a lot softer and easier of an adjustment, right? And it's just going to keep that baby healthy during that entire process of receiving that adjustment as well.
Thank you for that. That was very informative, and I'm sure my audience will love it. Guys, if there's any other topics that you'd like to ask Dr. Randolph, please let me know, and we'll see him on the next video.
Okay, so you can find me in Torrance, California, as well as San Pedro, which are both a part of the Metro LA